So the purpose of an interview to end the application process very often is to give the admissions committee an opportunity to verify all the information that you've indicated in your application, in the submission of your documents, and also in your personal statement. Hi, I'm Seraphine, and I'm an admissions coach at iComply. So medicine, for example, can have the interview process different for different schools. So for example, for NUS, they will have the FSA, where they might have 5 or 6 stations, which function very much like an MMI. They just call it a different name, but their objectives are the same. So depending on the stations that you go to, they might ask personal questions just to find out a bit more about you, and then also to find out whether or not you have aptitude and interest in the sciences. And then there might be role play scenarios, just to see whether or not you are able to handle complicated situations or challenging medical situations. They just want a general feel of your abilities across different skill sets. Okay, so for a question like this, what they are really looking for is your understanding of how complex a treatment plan or a situation can be. The patient might want to be able to perform at 100% very quickly after his surgery, and to perform at his peak, right, at the same level as when he was at his prime maybe. However, the doctor might be looking for more long-term results, where the patient is then able to still lead a normal lifestyle, maybe not at his peak, right? So certain compromises might have to be made. The reason why a doctor would not be able to guarantee or predict what the outcome of the surgery would be are that you do not know how accurate the patient history is, whether intentionally or unintentionally, right? Also, you do not know whether there are any other underlying conditions, and whether or not complications are going to develop during the surgery, and you cannot guarantee how or if a patient is going to adhere to the post-surgery plan. So there are so many factors that go into this process, and the doctor can't give guarantees. What the interviewers really want to know is your ability to distinguish between self-inflicted and non-self-inflicted illnesses or ailments. They want to know that you have sufficient understanding of the complexities of treating self-inflicted diseases. So what are they looking for? They need to know that you have some awareness of illnesses or ailments that can come as a result of the addiction. For example, somebody who is a drug user who uses needles could get hepatitis C. Somebody who is an excessive drinker could suffer from liver cirrhosis, and a heavy smoker could get lung cancer. Now, there needs to be an emphasis on fairness, because it's extremely difficult for a doctor to pinpoint whether or not the condition is a result of the addiction or if it's caused by something else. So they also want the interviewee to recognize that addiction is a psychological or psychiatric condition, and it's not something that can be diagnosed or treated immediately. So when it comes to deciding how to answer this question, what the interviewee needs to consider is that some diseases might be transmissible and need to be treated for public health reasons. So they can't say, oh, just because you're a drug addict or you're an alcoholic, I'm not going to treat you because this is self-inflicted, right? And if there is insufficient information at that point, and there's no time for the doctor to go and get this information, you can't possibly I think deny treatment just because you're uncomfortable about the patient's lifestyle. It's definitely not a doctor's place to judge. So certain decisions have to be made for the immediate treatment, and then deeper or action can be taken further to get to the root of the problem, but they cannot be dependent on each other. So a doctor needs to be objective and deal with these two issues separately. My advice to candidates would be to be authentic and to be yourself. Very often we come across candidates who think that they need to go in very serious to an MMI or an interview, and they don't let their personalities come through. I think it's really okay if you do have a big personality for that to be shown, right? Because doctors can have a sense of humor, and sometimes having a sense of humor helps, right? Just let your personality come through, because if you try and stifle that, then you wouldn't be authentic to yourself. Yeah. I wouldn't go into an interview and just talk about all your list of achievements and toot your horn about what you've done. All that's already been submitted in your application, right? This is an opportunity for you to explain further, reflect, and show them that you're able to have mature thought and that you're very serious about wanting to become a doctor. And then interview is the opportunity for you to tie everything up in a neat little bow. You've got the different stages of your application. You've got your grades, you've got all your testimonials that have been submitted. And the interview is the opportunity for the admissions committee to just verify everything and see consistency in your application.